So some of the common signs that asthma is getting worse would be increase in cough, shortness of breath, and wheezing. The symptoms usually tend to get worse at night time. You tend to find that the use of inhaler has substantially increased, and if you try to do your peak flow, that will be certainly reduced. So one of the common mistakes to avoid is to use the inhaler correctly. So that's need to be made sure that's being used correctly. And then avoiding of exposure to allergens such as smoke, dust, pollens, grass, which can affect the control of the asthma as well. And then sometimes there are untreated conditions alongside asthma which can trigger it, such as gastric reflux and hay fever, which needs to be controlled to have good control of asthma. And then sometimes the asthma is just very severe and needs specialized treatment, or there may be a missed alternative diagnosis which might be causing these symptoms instead of asthma itself. So one of the most common triggers is essentially the viral infections for which vaccinations are of paramount importance. Other things are avoidance of the allergens such as pollens, grass, dust, smoke. So these should be avoided where possible, and to take the medications regularly. So adult asthma is actually quite common, and that may be triggered by allergies, workplace exposures, by the respiratory infections, or other environmental factors. The common symptoms include recurrent wheezing, shortness of breath, chest infections, tightness, and persistent cough. So the asthma if the asthma remains poorly controlled despite symptoms, then this is the time to see a specialist, especially if there are frequent exacerbations. There might be diagnostic uncertainty for which it will be helpful to see a physician. And if there is severe asthma symptoms not controlled despite adequate treatment, then there might be role of the neurobiological treatments for which a specialist help should be sought.